Abdominoplasty, Wikipedia article audio. Abdominoplasty or tummy tuck is a cosmetic surgery procedure used to make the abdomen thinner and more firm. The surgery involves the removal of excess skin and fat from the middle and lower abdomen in order to tighten the muscle and fascia of the abdominal wall. This type of surgery is usually sought by patients with loose or sagging tissues after pregnancy or major weight loss. Abdominoplasty operations vary in scope and are frequently subdivided into categories. Depending on the extent of the surgery, a complete abdominoplasty can take from 1 to 5 hours. A partial abdominoplasty can be completed between 1 and 2 hours. Procedures. Complete abdominoplasty. In general, a complete abdominoplasty follows these steps. A partial abdominoplasty proceeds as follows. An extended abdominoplasty is a complete abdominoplasty plus a lateral thigh lift. The resulting scar runs from the posterior axillary line. The operation does all of the abdominal contouring of a complete abdominoplasty and allows further improvement of the flank, as well as smoothing the contour of the upper lateral thigh. This is an advanced technique that takes a little more than 4.5 hours to perform. Conventional abdominoplasty tightens muscles in a vertical line. In this new method, known as high lateral tension abdominoplasty, in addition to vertical line tightening, muscles are tightened horizontally. The final result with this technique is a dramatically flat abdomen with significantly better defined waistline. This new technique, also known as an extended mini abdominoplasty, allows for tightening and shaping through a smaller incision that isn't placed around the belly button. Through this smaller incision, excess skin is removed and the belly button is temporarily detached, floating above the muscles during this process. The muscles are tightened and reshaped from sternum to pubic area. The skin is then tightened and the belly button is reattached, or moved down 1 or 2 cm if desired. Liposuction may also be performed to achieve desirable results. Partial abdominoplasty. A circumferential abdominoplasty is an extended abdominoplasty plus a buttock lift. The resulting scar runs all the way around the body, and the operation is also called a belt lipectomy or lower body lift. This operation is most appropriate for patients who have undergone massive weight loss. An abdominoplasty can be combined with liposuction to make a lipotuck, which performs body contouring around the hips, thighs, and buttocks. Extended abdominoplasty. It can also be combined with liposuction contouring, breast reduction, breast lift, or occasionally hysterectomy, depending on the reason for the hysterectomy. A popular name for breast enhancement procedures performed in conjunction with an abdominoplasty is a mommy makeover. Abdominoplasty carries certain risks that may be serious or life-threatening. When making the decision to undergo such a procedure, it is recommended to compare the benefits with the potential risks and complications. Hence, all patients must be informed on all the risks they are exposing themselves to. Severe complications occur, however, in rare cases, and these include blood clots, thrombosis, cardiac and pulmonary complications, or infection. Infection and blood clots are a serious potential risk after abdominoplasty, but which occur rarely. Infection is usually treated with antibiotics and drainage. Patients are recommended to move around as soon as possible after surgery to minimize their risks of developing blood clots. Pulmonary embolism, heart attack, or stroke are very rare complications that may result after any type of surgery due to immobility after surgery, which results in blood clots that may travel to the heart, lung or brain. Thus, pulmonary embolism is a serious risk after tummy tuck procedure, and if they occur, they commonly happen within 3 weeks of the surgery, but more commonly within the first 72 hours after the procedure has been performed. High lateral tension tummy tuck. If complications occur, they usually delay the healing process. In rare cases, another surgery is needed to fix a potential complication. Skin necrosis is one of the complications that may require another procedure, as the dead skin must be replaced by a skin graft. Although necrosis is extremely rare, smokers have an increased risk to develop skin necrosis. Stopping nicotine use and smoking several weeks before and several weeks after surgery cleans the body and improves the chance of an uneventful recovery. Floating abdominoplasty or FAB technique. One of the more common problems after an abdominoplasty is collection of fluid under the skin after the drains have been removed. A surgeon can aspirate the fluid with a needle. The drainage stops within a month and does not affect the final results. Circumferential abdominoplasty. The scars resulting from abdominoplasty are long, brutal in appearance, and permanent. The size of the scar depends on the amount of skin that has been cut off, the techniques used for the surgery, the surgeon's skills, and the body's ability to recover. Although this scar will never become invisible, it is usually placed under the swimsuit line so it is covered by clothes. It normally takes 9 months to a year before scars flatten out and lighten in color. Possible risks of abdominoplasty include combination procedures. The cost of a tummy tuck varies from country to country and even within locales of countries. As with most cosmetic surgery operations, the cost depends on a variety of factors like the age of the patients, their weight, and the state of their health. Depending on the individuals, there may also be other costs involved after the operation. This does not include the follow-up visits as required by some doctors. In the United States, this procedure can cost from $4,000 to as much as $15,000. The preoperative and postoperative care, facility fees, anesthesia, and medications must be taken into consideration when reviewing surgery costs. No surgeries are a guaranteed success, and therefore a second procedure or a touch-up may be required to achieve the desired appearance. These costs are typically not included in the original cost. Liposuction, also known as lipoplasty, is a type of surgery that removes fat from the human body in an attempt to change its shape. Evidence does not support an effect on weight beyond a couple of months, and it does not appear to affect obesity-related problems. Serious complications include but are not limited to death, deep vein thrombosis, organ perforation, bleeding, and infection. While the suctioned fat cells are permanently gone, after a few months overall body fat generally returned to the same level as before treatment. This is despite maintaining the previous diet and exercise regimen. While the fat returned somewhat to the treated area, most of the increased fat occurred in the abdominal area. Visceral fat, the fat surrounding the internal organs, increased, and this condition has been linked to life-shortening diseases such as diabetes, stroke, and heart attack. Body contouring is a general term that refers to various plastic surgeries performed to different parts of the body with the aim of improving the shape and tone of the underlying tissue that supports fat. It is a common procedure performed for people who have undergone major weight loss. It may be performed in both men and women. Recovery. Breast reduction, or reduction mammoplasty, is the cosmetic surgery used in resizing the breast, in women with oversized breasts and men who suffer from gynecomastia. This type of surgery is performed to treat a breast condition known as hypertrophy, which refers to oversized breasts. This condition usually occurs in both breasts and commonly develops at puberty or immediately after. Risks. Breast lift, also referred to as mastopexy, is the surgical procedure that removes the excess skin and tightens the surrounding tissue of the breast, resulting in raising and firming the breast. Mastopexies carry a certain degree of risks as any other type of surgery does. Bleeding, fluid accumulation, poor wound healing, skin loss, numbness or other changes in skin sensation, anesthesia complications, skin discoloration and / or prolonged swelling, fatty tissue found deep in the skin might die, major wound separation, asymmetry, recurrent looseness of skin, pain, which may persist, persistent swelling in the legs, nerve damage, possibility of revisional surgery, hematoma, keloid, seroma, suture rupture, swelling, visible scar, death. Hysterectomies are sometimes performed with abdominoplasty. A hysterectomy consists in removing the uterus and it may be complete or partial. This procedure is normally performed by gynecologists and it is one of the most common gynecological surgeries. This type of surgery is used to treat some benign tumors, cancers of the ovaries, uterus, or cervix, adenomyosis but not endometriosis, and are also performed in trans men. Making the initial incision across the lower abdomen. The incision is placed in the bikini line and runs from hip to hip. The final sutures securing the umbilicus into its new position after an abdominoplasty. Cost. Related procedures. Image gallery. The removal of nearly 100 square centimeters of skin from the abdomen of a 40-year-old woman during an abdominoplasty surgery. Placing the final sutures following an abdominoplasty procedure.